Hi everyone, once again welcome to this channel. I am Dr. Shweta Adatia and I'm a neurologist who treats brain and spine, but I've been following all the COVID-19 news and as my responsibility for all my patients and other people, I have been posting important concepts and important ideas for people to be safe from COVID-19. Now, a lot of my patients are asking, what if I'm pregnant? Can I take the vaccine? What if I'm lactating? Can I take the vaccine? Yes, I will be doing the Hindi English version very soon. Let me finish in the English and then I'll move on to Hindi. And the third question is pertinently being asked is what will the vaccine impact on the fertility? That means, will there be any issues in the forthcoming generation, in the child? Would there be an impact on the fetus in case you're pregnant, etc.? So today we will go through one by one all the doubts in relation to this particular problem. Now, we are about 1.5 years into the pandemic. We all have known the virus. We know X number of people globally, X million of people are, every day this number is changing, and hence it's an X million people who are infected. Now, this is the time when we have a whole bunch of data available with us, and with confidence, certain things can be made very, 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 very clear. Now, certain countries have different types of vaccines which are available. Pfizer is available, Moderna is available, Covaxin, Covishield, Sinopharm, Sputnik. These are all the various vaccines which you have been listening to, and you might have access to. Some of you would have already vaccinated yourself. If you have not, I would request, please go ahead and get your jabs. Now, if you are pregnant, okay, there is currently no literature saying that you cannot take the vaccine, particularly if you read the CDC statement and guideline. However, you have to individually speak with your doctor and take a decision about it. Now, there are many, many varieties of the vaccine. There's something which is inactivated killed, there's something which is viral vector, there is something which is the mRNA or Moderna Pfizer. So for your benefit, what I'm going to do is I'm going to read out directly a statement from the CDC, which is released just of late in the month of May 2021. Now, there have been few patients who had been in the trial and then accidentally got pregnant. Did they have any of the side effects of the vaccine? Pretty much no. Did they have any impact on the delivery of the baby? No. Did they have an issue altogether in the long term for the fetus or the baby? No. So let me go through this data and you will have it popped up on the screen. Getting vaccinated is a personal choice. If you're pregnant, you can receive COVID vaccine. You have to have a conversation with your healthcare provider to help you decide whether to receive a vaccine which is authorized for the emergency use authorization. While a conversation is required and helpful, it may not be necessary. Key considerations are, now, for example, if you are a healthcare worker, pregnant, likely exposed to the COVID patients, your risks of fetus having the COVID becomes high because you are at a higher risk of getting the COVID infection. That is, if in those cases, it is better to have a dialogue with your doctor and opt for the COVID vaccination. Now, what is known about the COVID vaccine? We know that it works with antibody development. We know there are some side effects which are just known, simple side effects of the vaccine. Growing information about pregnancy is being collected. It is still limited, but we do have the antibody from the vaccine which gets into the mother can be transmitted to the baby. Recently, reports have been shown that people who have received COVID vaccine during the pregnancy, particularly the third trimester, they have passed on the antibodies to their babies so that they can be protected as well. Now, initially, the children as well as the adolescents were not part of the COVID pandemic. We used to say that it was a disease of the elderly. People who are aged, old can get affected, but that's not true anymore. We are seeing pretty much a big wide spectrum of people who are getting infected with COVID. Now, again, having positive does not mean that it is the end of life. But having an infection, a severe infection, serious infection, which affects the lungs, which can affect other organs, which can help your immunity to be completely unavailable and catch a secondary infection is what is more important. So again, let's summarize what the CDC says, that you can take the vaccine if you are pregnant, particularly in the last trimester. You have to speak with your healthcare provider. Definitely lactating, which means people who are breastfeeding. There are a lot of trials which are going on. However, this is from the CDC that based on how the vaccines work in the body, COVID-19 vaccines are thought not to be a risk to lactating people or the breastfeeding babies. Hence, lactating people can receive the COVID vaccine. Recent reports have shown that breastfeeding people who had received the vaccines had antibodies in their milk, which could actually protect the babies, which is fantastic. You are passively transferring the immunity to your baby as you are doing that. So, number 2 point, very clear. If you are breastfeeding, do not worry, you can take the vaccine without any problem. Now there's a big huge cry about the people who feel that fertility is at threat because of the COVID vaccine. This is going to be our point number 3. Is fertility a threat because of the COVID vaccine? Now you have to understand why people are worried. There were some reports which suggested that the antibody which is kicking in after the virus is similar to the antibody which is forming the fetus. Now I'm not going to name it because it's too complicated to spell, etc. But what is more important to know is there was this sort of a thought which was up there, and there were discussion among the scientists, etc. But it is absolutely unconcerning. It is not something that we have to worry about at all. Until now, there hasn't been any threat to the fertility, even for people who have been infected. I told you earlier, we have X million number of people who are infected in the world globally, and the fertility statistics have not changed. There has been no effect whatsoever on the fertility for any of the people across the globe. We have to exactly apply this analogy and bring it into the light of COVID vaccine. What we have to do is, if the patient is being administered COVID vaccine, generating the antibodies, essentially it is acting like a natural immune reaction to an infection. So basically you are receiving the inactivated vaccine but generating the same response for protecting your body. In all of these people, there has been no concern for fertility. So point number 3, for all the people, some of my patients who have raised these questions multiple times, this is for all of them. Please do not be worried that infertility could be a potential reason because of the COVID vaccine. No pandemic until now has ever been able to be won without having a proper vaccination schedule and covering as many population as possible. As we have talked about herd immunity, we have talked about so many things in the past. We have talked about the people being infected, we have talked about positive status, etc. But it is prudent, my request to all those of you who are pregnant, you want to ask a question particularly related to your personal health, I'll be more than happy to answer you and help you. I will be following up this exactly same video in the Hindi and if required in the Gujarati, just so that more people can be benefited from the same. So if you have any questions, please shoot, please ask. I am there with you. I am Dr. Shweta Adatia, and thank you for listening to me. Thank you.